From CBS 4 News, this is Facing South Florida with Jim DeFede.
Good morning. I'm Eliott Rodriguez, and welcome to Facing South Florida. Jim DeFede is off this Sunday. Football is back. Virtual schools have reopened. Indoor dining is allowed in both Miami-Dade and Broward, and curfews have been pushed back. Yes, life is slowly getting back to normal, our new normal, as we await a coronavirus vaccine. But what about the frontline healthcare workers? How are they coping more than 6 months into this pandemic? I recently sat down with Boulenger, Executive Vice President and Chief Operating Officer at Baptist Health South Florida, which operates 11 hospitals and has 23,000 employees. I started out by asking how his hospital heroes are holding up. More than 6 months into this pandemic, how are the frontline workers, the doctors, the nurses, and the other medical personnel at Baptist Health dealing with COVID-19?
Eliott, to say that this has been a major challenge would be a tremendous understatement. This pandemic has challenged American healthcare delivery system like no other prior crisis. These two waves or surges of cases that inpatients we've had to take care of in the 6 months have tested us like never before. And they've tested us and the other South Florida hospitals, but we came through magnificently for the community. We've seen firsthand the resiliency and dedication of our entire team, especially those that work on the front lines. This is incredibly challenging and emotional work. It's literally life-saving and life-changing. Our healthcare workers truly are heroes, and they've not faltered in answering the call.
Well, I want to talk about your frontline workers, because you say they're heroes, and they certainly are, but they're also human, and many of them are dealing with burnout, with anxiety and stress, and this might carry over later on. How is Baptist Health dealing with that, or helping them deal with that?
Well, you're right, Eliott. It's been tremendously stressful, particularly for the frontline workers. But I've never been more proud of these people and their showing of grit and determination. It's an incredibly challenging environment. Our employees are tired. They've gone through challenges that no one could ever foreseen. They're committed, passionate people who really care about the people in the community. And they've not only been caregivers to patients, but they've been caregivers to the patients' families. We're not allowing visitors right now because of the danger of contamination. And so they've been having to minister to the families. We've had generous philanthropy where they donated 100 iPads to help us make those connections so people could make those personal connections. And we've been trying to support our people with telemedicine, counseling, and free food, and lots of other ways to show that they care. We also want to make sure they have ample amounts of personal protective equipment, and that's really never been an issue for us, so that they can feel safe coming to work and taking care of these patients.
Have you had additional staff come in to supplement the people you have there at Baptist?
We have, Eliott. Right now, we're taking care of about 150 COVID patients a day that get admitted to our hospitals. At the peak, it was 850 patients a day. The average length of stay before COVID was 3 or 4 days, but these COVID patients stay 7 to 10 days. So you can see that we got full very quickly and exhausted our people. So one of the values of being a large 11 hospital system, we're able to move patients and staff around, and we did that on a daily basis. We also brought in rapid response teams from outside of the state to supplement our staff. And then recently, the state of Florida stepped forward with 300 nurses and respiratory techs to help continue to help us supplement our staff. We put them up at the Hilton on the Baptist Hospital campus, and boy, they have been a great relief to our staff, and we're grateful to the state for helping us out in this way.
Oh, I don't know about you, but I've heard people make comments and say that, oh, these numbers that we're seeing of COVID deaths are being inflated by hospitals. I've heard people say this without really giving any proof or any evidence to this. Have you heard this? And what's your response when you hear things like this?
Well, like you, I heard it on social media, but my response is absolutely not. We are very careful to follow all the guidelines from the county, the state, and the federal government. These are very serious guidelines. We take documentation and accuracy of our data very seriously. So I can say absolutely not. Let's put that rumor to rest.
What is the situation there with elective procedures at Baptist in light of what you're dealing with COVID?
Some of our hospitals were in a different circumstance than other hospitals in terms of availability of intensive care beds. So they were able to start elective procedures sooner than others. And we allowed our hospitals to make individual decisions about their ability to go back to taking care of people in the community. We are back to a place where we are doing all kinds of cases again in all of our hospitals. We did have to be careful there for a while in some of our larger hospitals about ICU bed availability, but that has been resolved and we're back to taking care of all types of cases that need to be done.
Talk to me about this concern that you have that people may have other health issues where they need medical attention. They need to go into the hospital, but for some reason they may be afraid to go in and they're not getting the care they need.
Well, you know, that's a real concern. And I mentioned earlier that Kaiser Family Foundation study, and we can see by our volumes in the emergency department and urgent care that some people are afraid and staying home. And we're hearing stories from fire rescue of people having heart attacks and strokes at home. So again, please rest assured that Baptist Health is doing everything possible to make sure our environment is safe and you are protected. And please do not delay care. Go see the doctor and come to the emergency department if you feel like your symptoms warrant it.
Bo, have you noticed that people have become a little complacent, maybe a little lax when it comes to social distancing, wearing a mask, and maybe people are getting together in groups bigger than they should? I don't know about you. I have noticed some of this recently, and it seems to me that it's pretty dangerous. What's your message about that?
Eliott, thanks for giving me an opportunity to talk about that. That is certainly a concern. You know, a month ago, we were very concerned about having full hospitals, and now things are much better because I think people learned the lesson over the July 4th holiday and afterwards about getting together with too many people. So we can't let our guard down. We know that masks and social distancing work. We've seen it work. It's a simple way to slow the spread of the disease in our community. And we really need to do it. We need to do it for each other, and we need to do it for the doctors and nurses that work in our hospitals. We're trying to get the message out. Recently, our chief medical officers authored a letter. All the regional hospitals got together, authored a letter to the community about it. And we're trying to engage social media and celebrities and everyone else. Let's please stay home, socially distance, wear masks, and wash our hands, and we're going to have this thing under control.
Now, several companies are in phase 3 of testing for a vaccine. What are you hearing about when a vaccine will be out there, and what will Baptist's role be once there is a vaccine made public?
Like you, we are very closely monitoring the vaccine development. We're very anxious for the vaccine to come out. Baptist Health is not involved in the vaccine development. That's being done by drug manufacturers, but as soon as it's out, we're going to embrace it and certainly offer it to all of our employees in the community. We're not sure yet what our role is going to be in offering the vaccine to the community, but whatever it is we're going to do, it's going to be very, very important for all of us in the community.
Okay, Bo Boulenger, COO of Baptist Health South Florida. Thank you very much for taking out some time to talk to us. Hospitals, including those run by Baptist Health South Florida, have been hit hard economically by COVID-19. The American Hospital Association estimates that U.S. hospitals will lose about $300 billion this year. Up next, the shortcomings of the state's unemployment system in a pandemic, how one state senator is leading the effort to help out-of-work Floridians. I'll talk to Jason Pizzo next.